Action News tonight is what so many people, not to mention public health officials, have been worried about: a fall resurgence of COVID-19. That is not to suggest that the virus was ever going away, but the numbers are now surging. For instance, Pennsylvania recorded 1,276 new cases over a 24-hour period for a total of almost 176,000 cases. This is the 9th straight day Pennsylvania has gone over 1,000 new cases. The average daily number of new cases is up by more than 50% compared to the past 2 weeks. Action News reporter Maggie Kent is live on the Ben Franklin Parkway. Maggie, a challenge for citizens and for public officials.
Right, lawmakers have to decide, or public officials, I should say, have to decide between economic health and the physical health of constituents as well. And what has been leading to this fall spike, according to those health experts, is definitely a COVID caution kind of relapse. People are getting tired of it, and more smaller groups are joining together inside indoor spaces.
We believe that we are at the start of the fall resurgence.
There is a rise now in coronavirus cases and hospitalizations in Pennsylvania. Though Dr. Rachel Levine says don't expect changes to our day-to-day life yet.
We have no plans to have any further business restrictions or stay-at-home orders at this time.
Why not? The state health secretary says PPE stockpiles are replenished. Testing and contact tracing has expanded. Hospitalizations, once in the 3,000s, are now in the 700s throughout the state.
We have so much more resources than we had in the past.
Here in southeastern Pennsylvania, Berks County has recently seen a sharp increase, and now that area is seeing double the number of cases that the surrounding counties are seeing for that same population. And Philadelphia's case count is seeing a rise as well.
Unfortunately, I think if we had been really systematic about following recommendations 6 months ago, we wouldn't be struggling as we are now with what to do next. And
Dr. Mitchell Kaminsky, Population Health Program Director for Thomas Jefferson University, says though there may not be a lockdown in the near future, it may be the best way to end the pandemic.
If we find that we're losing the battle with COVID and requires more sacrifice, I think we have to understand that short term it's best for the population.
And again, health officials encouraging people to continue with that mask usage, the hand washing, and they're asking that you get a flu shot as well, reminding people that those small gatherings, maybe 6 or 8 people inside of a house, are what has been leading to those COVID number spikes. We're live in Center City. Maggie Kent, Channel 6 Action News. Jim.